Hey everyone, today we are talking about one of the most common diagnostic questions in endodontics and oral radiology. How do you differentiate a periapical granuloma from a periapical cyst on radiographs? Both lesions occur at the apex of a non-vital tooth and both look radiolucent, but there are subtle radiological clues that help you make a more accurate diagnosis. Let's break it down in the simplest way. First, remember this. Radiographically, a granuloma and a cyst can look very similar. You often need histopathology for a definitive diagnosis. But our job as clinicians is to recognize patterns that can guide treatment planning. Now, one of the strongest radiological indicators is the size of the lesion. Periapical granuloma is usually small, typically less than 1 centimeter in diameter. The borders may be slightly ill-defined, especially in early stages, whereas the periapical cyst is usually larger, often more than 1 to 1.5 centimeter in diameter, and cysts tend to expand, giving a more obvious radiolucent area. Next, the border characteristics can tell you a lot. The borders of the granuloma are often poorly defined or less corticated because the inflammatory process is still active. You may not see a well-formed epithelial lining, whereas the cysts typically have well-defined corticated margins, a smooth radiopaque rim you will see that suggests slow or chronic growth. If you see a thin uniform white line surrounding the radiolucency, think of a cyst. Now, both the lesions appear radiolucent, but there is a subtle difference that exists. In case of granuloma, usually it is a uniformly radiolucent lesion, but often with less symmetry. In case of a cyst, you will see perfectly uniform radiolucency, sometimes more oval or round in shape, so it is symmetrical. Now, granuloma does not cause root displacement or root resorption, but in case of cysts, because cysts grow slowly and expand, they may start affecting nearby structures, more likely to cause displacement of adjacent roots or mild resorption because of hydraulic pressure. Definitely, you have to relate it clinically. Radiology is not enough. Always correlate the lesion clinically. Granuloma is often associated with mild symptoms. There will be TOP or acute inflammation. But in case of cyst, because it grows slowly and without much inflammatory pain, it may present to you as an asymptomatic lesion. Now, if you have a CBCT, the differentiation becomes even clearer. In case of granuloma, you will see features like smaller lesion, loss of trabecular pattern, less cortication, no significant expansion, whereas in cyst, you will see well corticated border, buccolingual expansion or perforation in the cortices, smooth round shape, possible thinning of cortical plates or perforation. Now, even with all these features, only histopathology can confirm the diagnosis. Radiology helps you predict, plan, and decide whether the lesion is likely to heal with RCT or if surgical intervention might be needed. But histopathology remains the golden standard. So, to summarize, cysts are larger, well-defined, corticated, they are more round, they may expand or cause resorption, but granulomas are generally smaller, less defined, and inflammatory in nature. And that's how you differentiate a periapical granuloma from a periapical cyst radiologically. Remember, size, borders, shape, and the effect on surrounding structures give you strong clues, but histopathology always remains the gold standard for a definitive diagnosis. Understanding these subtle radiographic patterns helps you make better clinical decisions and improves your diagnostic confidence as a clinician. If you found this explanation helpful and clear, make sure to follow this channel for more in-depth dental topics. Thanks for watching, and I'll see you in the next video.